Well, here we are today, and we are talking about Energy Star and Energy Star compliance. I'm with the Director of Facilities, Patrick O'Neill from Mason Health. How you doing?
Good. How are you?
Thanks for coming and talking with me about this. Where are we right now before we get into this conversation?
We are in our automatic transfer system room. This helps us if we lose power to kick in our emergency generators and keep the hospital running.
Very important at a hospital for sure. This is going to be a great interview. In a little bit, we're going to go check out the boiler room as well. You know, when you look at your appliances these days, you see that little square. It says energy. There's a star on it. Well, that works for microwaves and refrigerators and things like that. But it also works for large-scale buildings and things just like the hospital here and the campus. Talk to me a little bit about where we are now in Energy Star compliance. There's been some great things that have been happening.
Yep, this year we achieved our first Energy Star certification. Energy Star is a program under the Environmental Protection Agency where they evaluate facilities based on size and use of the facility. And we scored in the top quartile for our energy efficiency within the hospital. We're actually at the 86th quartile.
So these are things when you're looking about, airflow or lighting or ways that you're using. A lot of folks talk to the LEED standards too. Is that right?
They do.
Okay.
Yep, with that. A lot of stuff that we put into our planning, as you mentioned, airflows, and through our building automation system. After hours or when certain portions of the building aren't used, we're able to do setbacks, and which reduces the amount of energy that we use during that time, and really helps us focus the energy for when we need to use that during the time.
And so you're able to then determine, high usage times and shut off certain areas or at least lower certain areas of the hospital to not output that much energy. I don't know, at the cafeteria, for example. Yep. Things like that.
Yeah, we actually are. Our system actually runs on a DDC system, which uses variable frequency drives. So depending upon the need of that room at the time, because we monitor temperature, humidity, and everything in that room, it can increase or decrease the speed of the fans and the equipment that's using to maintain that environment. So we install occupancy sensors throughout the building. So when someone walks into a space, it would light up, or if it's vacant, lights would go off and so forth.
When it comes to those occupancy sensors, I've seen those, and like we were saying just a second ago, they have them kind of in houses now. What are some of the realized energy savings when it comes to that? I know when I go, or when my kids will go into the room and they'll flip the light switch on and then leave, while the light switch is still on, and that can continue and continue.
Yeah, all those little kilowatt hours add up over time. The more that you can reduce is better. I don't have a specific stat for you right now on savings, but they do. The more you can keep the lights off, the less kilowatts that you're actually using throughout the day.
And kind of less opportunity for human error and less opportunity for, humans to keep those lights on when they don't need to be in there.
Yep, absolutely. A lot of times at the end of the day, you're in a hurry to leave, and sometimes you forget to turn the light off, just like you forget when you leave your house. So these just do that for you so that you remember to save the electricity where we can.
The other thing that I know and I've seen as we've come through and have come around the hospital in the evening hours, the lights outside, even the street lights or the parking lot lights or even the lights that kind of light up the outsides of the building. PUD has worked hard over the years to change the city lights from kind of those yellowy orange lights to the LED lights, and they're all over the place here.
Yeah, a few years ago, we actually did an LED light conversion to all of our exterior lights, so they're all run through LED now, which takes significantly less energy than the previous lights with that. They're all on light sensors as well, too, so as soon as daylight comes, the lights turn off and turn on as needed.
What are some of the other things that you guys have implemented over the last year or so, not only to get into this Energy Star compliance, but just in general to help the overall energy savings of the hospital?
So with all construction projects, such as the Mason Clinic, in which we did a bit focused on energy savings there, from the building envelope, how sealed it is, how efficiently it works for us, implementing those setbacks that I spoke about for after hours when the clinic's not used. We also installed a hot water system that heats the building running at 55 as opposed to 65 for people. So just that little change in difference can save significant energy as you're trying to heat and warm a building.
And so as Mason Clinic was being built up and you were following all the guidelines of those current standards, you probably had an opportunity to evaluate what's going on in the other side of the hospital and look to bring those certain aspects of those up to new code?
We did. Over the last couple of years, we've converted fluorescent fixtures that we have from a T12 ballast down to a T8, which is 35% more energy efficient. Also, we look for opportunities whenever one of those fluorescent fixtures fail, we'll try to replace with an LED fixture of similar.
How long do the lights last from fluorescent length to an LED length?
Fluorescents, typically you're changing them possibly a couple times in a year to one time a year. LED could last you years.
Wow.
Run with that.
So not only the energy savings, but then the labor savings. And
yep,
stuff like that.
Time, labor savings, and with that are.
Well, that's really exciting. That's a really great thing to be able to show the community that the hospital is doing what it can to become Energy Star efficient and get those certifications. And that's going to be a big deal around the hospital water cooler, I guess. If you're talking from this hospital to this other, hey, we just got this. That's a pretty big deal.
Yeah, it's a great thing. It's really good. It shows the time and effort that everyone puts into being energy efficient around here. In addition to energy savings, we have our Practice Green Health team, which looks at recyclables, energy usage, chemical usage that we use, overall looking at how we can reduce that footprint.
We're going to be talking with Doug Darling here in a second in the boiler room and find out what's going on in there. But who are some of the other great folks on your team that have been integral in helping you with all this?
A lot of part for our Practice Green Health team. We have our lab director in there, Brandon Omerson. Trevor, our EVS manager from material supplies. Everybody's a whole organizational drive. We have members representing everyone that works here.
Patrick O'Neill is the director of facilities here at Mason Health, and through the clinic, they've done a lot to upgrade the standards and be Energy Star compliant. Thanks for your time.
Great. Thank you very much. Thanks for coming out.
I'm now here with Doug Darling, the facilities supervisor. He's been here for almost 17 years, and we're in the boiler room, someplace that a lot of folks have never seen at Mason Health here. How you doing?
Doing good.
Thanks for talking with me here and talking us through this. And this is a pretty cool thing for the hospital to get these Energy Star compliant capabilities. And I know you have seen over the course of your time the upgrades needed to kind of match what's going on over at Mason Clinic, which was, essentially a fresh build with those LEED standards.
Yeah.
And now the rest of the hospital has been built up to that.
Yep. Yeah, over the years, it's a lot of electrical. The exterior lighting, we retrofit all the pole lights and everything with LED. That was a couple years ago. A few years before that, we changed out all of the interior lighting from T12 bulbs to T8 bulbs. Those are about 35% more efficient than a T12.
Wow.
There's also T5 bulbs, but it's not a big gain. So now what we do, if we lose an incandescent or a T8 bulb, we try to retro to an LED if possible.
Sure.
Other than that, we got our boilers. This runs the heating for the whole place. These run off of natural gas mainly, but we have diesel as well. And then we have a DDC, our building control system, and that's what controls all of our air handlers. We have night setbacks to try to reduce energy usage.
Sure. So how do you go about doing that? I mean, if you've been here 17 years, you kind of know the ebbs and flows of when people come in and when people go out. How do you maintain those controls so you're able to get down, to a little lower levels, maybe in the overnights or something like that?
Yeah, a lot of it is kind of trial and error in some spots, but some things are, like kitchen, for example, they're not here after 8 o'clock, so now we can dial back because that's a big deal in the basement down here. But as far as upstairs goes, that's trial and error on airflows and doors opening and closing and locking and this and that. So it's a little more challenging because upstairs is 24/7 everywhere.
Yeah. Have you been able to adjust and modify those settings to be more automatic as the years have gone by? Like, does the boiler know then, well, it's coming up on 7 o'clock, so we're going to cut down a little bit of the power?
This all runs off the usage. So yeah, once there's less people here, less hot water being used, then this is everything. A lot of these, though, run off of the temperature outside. So, depending on how cold it is how much these work.
And was there a time where it was basically all on and all off, or have you always had the capability to kind of compartmentalize the
No,
different areas?
there's been upgrades. They're called VFDs, variable frequency drives, that we put on these air handlers. They used to be 100% all the time. Now with these VFDs in our building automation system, that allows the units to go by parameters, and that's what dials them back.
Okay.
So yeah, those have been, they're probably right around 10 years on some of them, but nowadays everything comes with that because of the setbacks.
And then when it comes to the potential for the energy savings, you know, how much have you guys been able to see or realize that, wow, by doing this, it's been able to save us that?
That aspect of it has never been really tracked as far as the savings end of it. We just know that it's the right thing to do.
Sure.
So that's the, you get these bulbs that are 400 watts outside, and we take them and we change them to under 100.
Yeah.
I mean, that's 4 times as much savings. So when we did the exterior lighting project, we worked a lot with PUD, and you look at your return on investment and everything else, and it's a very short window, just a few years to get your money back just in electricity usage. And that doesn't even take into fact that the maintenance on them. Because anytime those go out with the old bulbs, you had to have a truck out and do all this work on them. So they're a lot less maintenance, they're a lot less wattage, so it's just been good all around.
And then too, the safety aspects of it and just the brightness of the new lights, the LED lights, it's amazing.
Yeah, they went from like the orange hue to the 4,000 to 5,000 color spectrum where they're nice and bright. They're way better for camera usage and everything else for safety.
This is a great place to be, especially these days where it's a little cold outside. It's warm in here right now, and it needs to be that way to help heat the whole hospital. These are pretty big boilers here.
Yeah.
What would be kind of the normal square footage, or
One of these can run our entire hospital and the clinic down to about 32 degrees.
Wow.
And then once it gets colder than that, then we need another one to pick up, but never more than 2.
Wow. Well, again, Doug Darling is here. He's been here for about 17 years, so he's really seen the upgrades and the changes when it comes to Mason Health and the hospital here. And kind of a nice sneak peek behind. I mean, I've never been down here, and I think there's a lot of folks that have never seen this before. I really appreciate the time.
Yep, thank you.
Time now to add on to another portion of this conversation. We've talked with 2 great guests from Mason Health already on the Energy Star compliance side of things with Mason Health. And now we're going to talk with Jen Capps from the hospital, as well as Kaylee Sheehan, who's the Sustainability Strategy Manager for Practice Green Health. Now, back in July, Mason Health was awarded the 2021 Practice Green Health Environmental Excellence Award, and that goes to look into ways that they bring out sustainability into the community, and it is a nationwide effort that hospitals are saying, we're trying to do this, but only the cream of the crop rises to the top, and that's Mason Health. So Kaylee, let's start with you a little bit and just explain what Practice Green Health is and the process that these hospitals have to go through to look for this and hopefully, I guess, get this award from you.
Yeah, hi, thank you for having me. As you mentioned, I'm with Practice Green Health. So we are a nonprofit membership organization based in the United States. We've got about 1,500 hospital and healthcare organization members. And what we do is we work to really innovate, scale, and transform the healthcare sector. We're looking to help healthcare organizations implement environmental sustainability within their operations to reduce their environmental footprint and really provide care to the communities and patients that they serve. As part of that, we do have an annual Environmental Excellence Awards program. It's very competitive. And we recognize those institutions that have really worked to instill environmental stewardship within their operations and drive performance. And that application serves as a tool in a number of ways. So it helps hospitals assess what they're currently doing and identify all the achievements and highlights of their work, and also identify opportunities to continue to improve, right? Because the target continues to move. We need to really work to reduce our impact overall. And so this award recognizes those achievements and helps hospitals kind of navigate going forward. And Mason Health did an excellent job. It's demonstrated in their, commitment to their community and to their environmental programs.
What would be some of the things that the end user, I guess, the patients at the hospital would notice in either their the way that they receive meals or the types of meals, or what are some of the things that they may see that seems a little different from a hospital visit of 10, 20 years ago?
Oh, there are so many things. Even simple features like garden spaces outdoors or nice walkways, access to daylight throughout a hospital. It can be kind of a gloomy environment, but having that access to natural light, natural surroundings is something. Looking for signage for where to dispose of, food wrappers or something. Oftentimes now you'll see a trash bin, a recycle bin, a compost bin. And that wasn't the case, 20 years ago, like you alluded to. You might also see water saving fixtures. So having sensors at your sinks or water bottle fillable stations. And that also looks at things like the food that's served. Mason Health has done an excellent job really looking to promote local and sustainable foods, plant-forward foods, which better serves the patient and their community, right? Looking at those healthy options that are tasty and quality, but with fresh local ingredients.
Jen?
Oh, go ahead.
No, I'll finish up there. That's great.
There are just so many examples to pull from, but Mason Health has really done a great job.
Jen, we've talked over the years for sure about folks who, come to the hospital for the great food that has been there. And, the environment and the community around us is so blessed to be, have fresh seafood and fresh greens and farms and plants and vegetables all around it. These are the types of things now you guys are looking local for sourcing the food at the hospital?
Absolutely. Cody Shipley is the manager of our culinary nutrition services. And I tell you, every time I talk with him, I learn something new. We've implemented, vegetarian type meals. He looks at healthy ingredients, looking at local vendors, local dairies, local farmers for all of our yogurt and produce and meat, because the local supply chain for our food keeps us healthier. We know who's growing our food, and we have vendors like the Humble Stump farm. They actually grow the lettuce for the entire district, specifically for us. So, before Cody, I don't think we had nasturtiums, which are edible plants, in our diet, just as an example. So, we still have those wonderful, tasty meals that are little treats every once in a while, like our famous prime rib every once in a while. But he's really trying to work hard to make sure we have local food and that we're eating things that are healthy for us and that are going to help us, maintain our health, particularly during the uncertain times that we're having now, but now that we're coming out of. So he does a really great job and very cutting edge.
So this award came to you in July of last year, the Environmental Excellence Award from Project Practice Green Health. But I can imagine conversations were being had as you were designing and getting ready to build the clinic. As you've taken me through there a couple different times, and there are different aspects of the clinic that I can hear as Kaylee's talking about some of the things that they look at.
Yeah, and as we're building the facility, we really wanted to look at green opportunities to reduce our environmental impact. As Patrick is sharing with us, is that we're really trying to be energy efficient, and we also have, like, in our main registration area over at the clinic behind the registration desk, it's reclaimed wood. So we're really trying to be good stewards and be good stewards and reuse things that are in the environment, so that we're not creating more waste as much as we possibly can.
And Kaylee, talk to me a little bit about kind of the competition that you see between hospitals when they are submitting their applications for this. Do they invite you to come down and try some of the delicious locally sourced meals? My mouth is watering now as we're talking about it. I know you're just up the road near the border, and there's a great opportunity to do that. Or how do these hospitals kind of show that off in a paper application setting?
Well, the application is extremely robust. I'm sure Jen can speak to that, but
Absolutely.
it is a huge undertaking. So there's a lot of data that's submitted. There are attachments so that we can see, links to their newsletters and videos. I mean, of course, I'm biding my time waiting to come down and actually visit and get to check it out in person. But the applications range. Some hospitals really put forth a really impressive effort, and others not as much. But it comes through when you can really see the story that they're telling, and you get a sense of the organization itself and kind of how they're integrated into the community and serving the community.
Jen, I know it's not just you that's working on all this. Who are some of the other
No.
departments or leads, or who do you want to talk about?
Well, there's so many people involved in this, and so I want to give a sampling of the folks that are involved with it. So our Mason Health Green Team is composed of leaders from supply chain, surgical services, clinical informatics, maintenance, culinary nutrition services, the finance department, compliance, human resources, pharmacy, lab, the development office, the marketing team that's also in my office, infection prevention, employee health related to COVID and safety practices. And all of those leaders also have teams supporting them. So it really does span the entire district. And I'd say we, have, a dozen or so leaders and then all of their teams that are supporting it as well.
That's great. And I'm glad that this kind of was able to put the button on this other parts of our conversations to show the boiler room and to show off the area that has kind of the energy switch over there with Patrick. It was a great conversation here, and with Kaylee Sheehan as well, who's again the Sustainability Strategy Manager for Practice Green Health. And we're talking about that award they got. Mason Health got back in July, the Environmental Excellence Award. And when you go up to the hospital, into the clinic, and just talk with the folks around, you definitely see that things look different, and there's a different feel to these hospitals. They're less, I don't know, they're less hospital-y, I guess. They're less sterile, less what people kind of have perhaps an old idea of what these places are like. Kaylee, it was really nice to talk with you. Jen, it's always good to talk with you, of course, and we'll check in down the road. And here's to hoping for the 2022 Environmental Excellence Award.
Fingers
so thank
crossed.
you. Yeah, for sure. Get that paperwork in, I think.
I'm
Kaylee,
telling you,
thank
I'm
you
working
again.
Thank you, Jeff.
For sure.